Hey, we are talking with Janine Nesin of Nesin Therapy here in Huntsville. And we just wanted to have a conversation. She's a local business owner. This is a women's owned business. And it's been in Huntsville since about 1987. Is that right, Janine?
That's correct. That's correct.
All
My
right.
mom actually started the business.
Oh, nice. All right, great. And you have multiple locations, right?
Right. We have three clinics in the Huntsville, Madison area. So one near Crestwood in southeast Huntsville, one in Research Park, and then one out in Madison on County Line Road.
Great. Okay. And what was it that made your mom start this business?
So really the focus was on, she was a mom with four kids. So she wanted a flexible schedule to still leave some family time. And the other thing she wanted was to control the quality of physical therapy care. So she saw a lot of things changing in the landscape with healthcare at the time, and in particular physical therapy. And she wanted to be able to control the quality of services she was providing. So she started out on her own. But back when she was in charge or running the company, we were doing primarily contract work with home health and skilled nursing facilities. When Michelle, who's my older sister, joined the practice, and then myself, we both got our PT degrees. She got hers from South Alabama. I got mine, my doctorate from Creighton University in Nebraska. And when we joined in, we saw things changing in home health as well, and in the landscape, continued kind of changes. And we decided it was time to take control again over the quality of services that we were able to provide. So we decided to open our own outpatient clinics.
All right. Wow. So at first you contracted out to other, I guess, physical therapists, and okay.
Yeah,
So now you're
home
doing it.
health agencies and skilled nursing facilities. So we were working through them to provide their care.
Gotcha. Yeah, and so if people visit your website, Nesin Therapy, excuse me,
That's all right.
there, it's a nice website, and you can see all of the different things that you work on, from orthopedics, sports injuries, women's health, men's health. You break it down by, body skeletal type, I guess, spine, shoulder, elbow, anything you need. You guys, you do it well. You ladies do it well, I should say.
Yep. Thank you for pointing that out, Drew, because we actually just updated our website. So it just went live. Our new website went live this morning. So I appreciate you bringing that to everybody's attention.
Oh, nice. Just this morning, huh?
Yes.
Oh, so can you explain a little bit about you have a hands-on approach. So in some cases, when people need some therapy, physical therapy, sometimes they'll just be assigned exercise.
Yeah.
But you and your Nesin Therapy actually does hand-on, like, kind of massage.
So, trying to explain to people manual therapy without them ever having experienced it for themselves. We try not to give the impression that it's massage, because massage implies that it might be a fun, comfortable experience. And for the most part, it is. The manual techniques that we use working on the joint mobility. So we work specifically on how the joint is moving, because sometimes with various injuries or pathologies, you lose actually the normal movement and the normal mechanics in the joint, as well as in the soft tissue, which typically is muscle and tendon and nerve. So those are things that you might get worked on by a massage therapist. So some people are familiar with some manual techniques, but not necessarily the entirety of what we do as PT. So it's working on the joints, restoring their normal motion, working on the musculature or tendons or ligaments, working on their motion and mobility. And that combined, that makes it helps relieve the pain much faster, restores the normal motion much faster, and therefore makes the exercises that then we assign much more effective, right?
Wow.
working through painful joints. You're not working through painful soft tissue. So, so those manual techniques combined with the exercise makes for a much more comprehensive rehabilitation. Plus, we're looking at when we look at a patient, we're looking at the biomechanics of not just the painful area, say it's a knee, but what's going on at maybe the hip and the ankle, that they aren't moving as well as they should, and they're contributing to adverse or abnormal mechanics at the knee. So you got to look above and below at the whole person to see what is contributing to the entire problem. So that's really the more comprehensive approach that we try to take here at NISA.
That's fantastic. Yeah, just in reading some of your website stuff here, like the foot and ankle section talks about the shins. The knee section talks about, how the foot and ankle and the knee can affect your lower back. And so, we're a system. So
yeah, exactly. Nothing occurs in isolation in the human body, that's for sure. So.
Right. So you are considered an essential business.
Yes.
And Nesin Therapy is open during this pandemic right now.
Right. So we have, at any given time, as a healthcare provider, we had patients who were coming out right before, the Thursday hit, where the pandemic really became a real thing in our local area. But you have patients that are in the middle of post-surgical rehab or in acute pain. Waiting 2 weeks to a month would have been devastating to their rehabilitation or their quality of life. So we have to stay open to treat those patients so they don't go backwards. Because there's some that are low risk but high need, and then we're trying to discourage those patients that are definitely high risk not to come into the clinic to take advantage of, say, our telehealth services, e-visits, that type of thing. So but those that need care, like the post-surgical rehabilitations, we have to continue to treat them and stay open for those patients.
And so what are you doing safety-wise to make sure that your patients and that your staff are safe?
So we are wearing personal protective equipment. So we have masks and gloves that we're using for close contact patient care. We've set up social distancing for the reception area, but we're trying to encourage patients to come in right at their appointment time, and then they're immediately taken back. We're spacing out, we spend most of our time treating in individual treatment rooms, which is rare in the physical therapy world. So we feel like we're uniquely positioned to kind of keep our patients isolated from one another, as well as the therapists kind of spread from one another, versus treating in a gym type setting where everyone's in close proximity. So, So, any gym equipment that we're using, we're cleaning all the time, as I'm sure other essential businesses are as well. So that's what we're doing at Nesin Therapy. And when we've set up, the shields for our office staff, and if they're in a more open office type environment, we've set up shields to protect them, but most are in enclosed areas. So we're trying to space people apart and keep them separated from one another, and wearing protective equipment.
Good. Yeah. And keeping the circulation going.
Yeah.
In windows where you can. Yeah. Interesting times we have here.
Yes.
So, is there anything else you'd like to say to the community, or, any closing thoughts?
No, the governor just posted today that there are going to be medical procedures that are starting back up again. People that were delaying surgeries are going to, we're going to have to start back at some point. So I think the governor feels like it's safe to start some medical procedures, which means patients will be coming back in for rehabilitation once that happens. So we do feel like we're uniquely positioned to be as safe an environment as can be had in physical therapy, because we do have individual treatment areas. And the thing is, once patients are, COVID-19 has some serious side effects or health consequences post. So, those patients are on down the line, once they're safe to return out into the community, are going to require rehabilitation as well, many of them. So, we're here to help everyone who's in need at this point, and we're trying to provide telehealth services to those that are at higher risk.
Good.